Okay, so let's get started. Thank you all for joining. This webinar is about CHAMPS, Communities and Hospitals Advancing Maternity Practices, and it's specifically about CHAMPS and New Orleans, or the New Orleans area, which is one of the areas that our project is going to be working in. Let me see, now it won't let me advance. There we go. So today we're going to be doing an overview of the CHAMPS project for those of you who are in the New Orleans area, and including also some members of our team who are on the call. CHAMPS is Communities and Hospitals Advancing Maternity Practices. It's a breastfeeding-focused initiative which is seeking to improve maternal-child health outcomes and exclusive breastfeeding in the areas that we're targeting to begin with, which is Mississippi, New Orleans, and Southern Texas. We have just begun this project. The start date was the 1st of August 2014. It is a 3-year project, and it is funded by the W.K. Kellogg Foundation. We have some guest speakers on the phone who are just going to give us a little bit of a flavor of why this matters in the area that you're in. I'd like to introduce first Dr. Joya Kriya-Perry, who is the National Medical Association Board Trustee for Region 5, the chair of that region. She's also the Executive Director of the Birthing Project, former Director of Women and Infant Services at Jefferson Community Healthcare Center, and Director of Services at City of New Orleans Health Department. She was trained at Louisiana State University in Tulane, and she's a fellow of ACOG. So, Dr. Joy, if you could just give us a little background as to why this matters in the area that we're working.
Yes, and I'm so honored. Can everybody hear me?
Yeah. Yep.
Okay, great. So honored to be able to bring greetings from New Orleans and from the maternal and child health community in New Orleans. You know, as a person who's been active in that community for a while, having a focus on breastfeeding has been important to us for a very long time. I could tell you that training there and being a part of LSU and the Tulane system, we didn't get a lot of training in breastfeeding, and then going into private practice, there was a big gap. There's always been a gap between kind of what some community members had access to when it came to breastfeeding and others. And I love to say in New Orleans, we are conservative in the traditional sense of the word. We conserve our culture, and so changing the culture around breastfeeding is going to be difficult, but definitely not impossible. And it requires all of us to participate. That includes the hospitals. So I hope that we have quite a few on the phone now that are encouraged and want to participate to help, because it's so important to have breastfeeding. As you know, all the maternal benefits for decreasing breast cancer risk and all the benefits for the baby. You know, we're preaching to the choir when it comes to that. But the hard mission, though, is making sure that we all do this together and that the hospitals are come on board. And so I'm grateful for Kellogg and for the folks from Boston to come and help us to get this going. So I appreciate it, and welcome to New Orleans.
Thank you very much. Thank you. And also Monica from the Department of Health is going to speak for us. Let me just change the slide here. So Monica McDaniels is the Assistant Director of Nutrition Services at the Louisiana Department of Health and Hospitals, Office of Public Health, and she's going to tell us a little bit about why this matters too, and then give us an overview also of what's already been going on in the New Orleans area. So go ahead, Monica.
Good morning, everyone. The collaboration with CHAMPS and our Louisiana residents in New Orleans is it's quite significant. From the WIC perspective, the Special Supplemental Nutrition Program for Women, Infants, and Children, New Orleans has some of the highest breastfeeding rates in the state. So we already have piqued the interest of our WIC population. And we also have a very significant breastfeeding population among non-WIC participants in the city of New Orleans. So I think we have a captive audience for which to build upon. Also, we do not have any baby-friendly certified hospitals in the New Orleans area, so this is an excellent opportunity to collaborate with our hospitals to get them on board, although we do have 2 breastfeeding-friendly hospitals within our state, none of which are in the city of New Orleans. Also in the city of New Orleans, we have very good community support, very collaborative community efforts have been going on to increase our breastfeeding rates and promote breastfeeding across the city of New Orleans and the surrounding areas. So although we do see our numbers increasing, we need to see breastfeeding numbers stabilized in the city. We also need to see a consistent message sent from the hospitals to the clinics, to the physicians, pediatricians' offices, OBGYN offices, letting our mothers know that breastfeeding is the norm instead of the exception, to kind of change our culture, as Dr. Creer Perry stated. And also, my hope is that the end result will be a litmus model for the state of Louisiana, so we can extrapolate this model across the state. Moving on to the next.
Yeah.
Yes.
Go ahead.
Yes, moving on to the next slide, we do have what I guess you'd say a double-edged sword or dual participation as it relates to, we have the WIC program under the Department of Health and Hospitals as well as the Bureau of Family Health. And we collaborate on many ends to promote and support breastfeeding. From the WIC perspective, of course, we target the WIC participants. We also have had the Breastfeeding Peer Counselor Program, which was incepted in 2005 through USDA grant funds. We've also had, last year we completed a community engagement project and focus groups to engage our community as well as our participants and meet them where they are. And then we also conduct routine annual breastfeeding training, because we believe that breastfeeding training is key for our staff as well as our community partners. So those are the things that are going on under the umbrella of WIC. Also under the umbrella of our Bureau of Family Health, their particular charge is to target the Louisiana hospitals, and in doing that, we have the GIFT initiative, which was incepted in 2007, which has gone over quite well, and we have assisted quite a few hospitals in becoming GIFT certified. We also are charged under the Bureau of Family Health with supporting the Louisiana Breastfeeding Coalition staff to work not just New Orleans, which we do have a strong presence, but across the state of Louisiana. And we're also expanding our reach under the Bureau of Family Health with the COFECTIVE team, which we have working with us this year to reach out to those hospitals through literature, through mobile apps, to reach the hospitals and send a consistent message. And like I said earlier, we're also working with our local Louisiana hospitals on the baby-friendly designation. So this is where we are. So CHAMPS will be a very good complement to what we currently have going on in the state of Louisiana. The slide you see in front of you is simply just some data that is relative to our WIC program and the efforts for breastfeeding. Of course, the Louisiana breastfeeding rate is about 19.3 at this point, and we do have quite a few moms who are fully or exclusively breastfeeding, about a little over just about 1,800 partially breastfeeding moms. Our total WIC participation is 133,000 at this point, and we target those pregnant moms, and we support those breastfeeding women, and that's pretty much where we are right now.
Thank you very much, Monica. That's great, and it's great to have your support here on the, with this initiative. We're really pleased to be working together with the Department of Health to do this. CHAMPS, as in terms of the big picture, our overall goal is to increase exclusive breastfeeding rates in the South, which is a pretty lofty goal. but we are basing it on changing practices in the hospital and engaging the communities with that change in practice, because we know that the Baby Friendly Hospital Initiative increases breastfeeding rates. So our goal is to enroll 25 hospitals in Mississippi, New Orleans, and southern Texas, and to help at least 10 of those hospitals to become baby-friendly designated. We do know that not all the hospitals at this point are ready to jump in and say we'll become baby-friendly. We've been asked by our funders, Kellogg, to target areas where there's very little knowledge about baby-friendly and breastfeeding, just to try and make some change in some of the areas where there really hasn't been much change to begin with. So we know that we won't necessarily make all 25 hospitals baby-friendly, and they're not every hospital signing up to become baby-friendly, but we do plan to work with those other hospitals to make their practices improved and to get better conditions for moms and babies. So this is myself and Kim Bogg. We are the two kind of leaders of the project. Boston Medical Center is right up here in Boston. Yes, that's a long way from Louisiana, but I will explain to you hopefully in a couple of slides why we are charged and privileged to be doing this work. Kim is also going to talk a little bit about her organization, Rose, and as I said, we're funded by Kellogg. So my own hospital, Boston Medical Center, up here in the north, we actually are the largest safety net hospital in New England. We have 2,500 births a year. We're in a level 3 15-bed NICU. We're affiliated with the BU School of Medicine, which has residency programs in many specialties, so we're a teaching hospital. And we serve a very underprivileged population up here. 56% of the women who give birth in our hospital are African American, 25% Hispanic, 11% white, most of whom are immigrants from Eastern Europe. 53% of our hospital is on Medicaid, and before Obamacare and before the Massachusetts version of Obamacare, 24% of our patients didn't have any health insurance at all, and 80% of them are eligible for WIC, which is compared to a 50% rate nationally. So we serve a very underprivileged population. I started working on lactation at Boston Medical Center back in 1997. And my kind of charge there was to see breastfeeding mothers, which was quite difficult because we didn't really have any way of recording who these people were. Nobody was really breastfeeding. And in fact, we did a survey of 1,000 calls coming into our outpatient pediatric unit, where people just call up about their baby and their problems, and not a single phone call was related to breastfeeding because no one was going home from our unit breastfeeding, really. So when the first times that I was working there, our knowledge was very poor. The policies were really obstructive to breastfeeding, and we had this overall sort of thing that everybody said, oh, well, our moms don't want to breastfeed. And we decided we weren't going to buy that, and we decided that we were the problem as the hospital, not the moms who were coming in, but we were the problem because we were causing all this chaos down there that was not really allowing anyone to breastfeed. So we decided to change the hospital policies and the systems that were keeping moms and babies apart and obstructing breastfeeding. We began a big staff education program for lactation, and we decided we had to reduce the infant formula influence in the hospital because we were taking it for free and we were giving it out everywhere. And we did a lot of work, and we became baby-friendly designated in 1999. We were one of the very early adopters in this country doing that. And it made a big difference to our rates. And remember, this is the rates of breastfeeding in a very impoverished population. So in 1995, before we did any of the baby-friendly stuff, our breastfeeding initiation rate was 58%. And in 1999, once we had implemented baby-friendly, it went up to 87%. And it's now in the high 90s, 10, 15 years on. Initiation among U.S.-born African Americans, that was our lowest initiation rate. We have a lot of different types of black communities. We have Haitians, we have women from Africa, but we look, direct from Africa, but we look particularly at U.S.-born African American women because they are the ones that have the lowest breastfeeding rates in the country. And their initiation went up from 34% to 74%. And then exclusive breastfeeding, we were only at a very pitiful 6% of people exclusively breastfeeding in 1995 before they left the hospital. This is right in the hospital, and that went up to 34%. And we also did look at the rates in our NICU, and we saw that those rates also went up. And we raised our overall breastfeeding initiation rate in the NICU for our sickest children from 35 to 74%. Similarly went up in U.S.-born African Americans. Some data I just found really interesting that we really increased rates among non-U.S.-born African American women who are actually traditionally our highest breastfeeding population, but we're not doing so in the NICU, presumably because we just did not have a system in place. We didn't have pumps for them. We didn't have a good way to get them in there and help them breastfeed. But once we changed everything, that rate shot up to 81%, which is where that population group should be there in the high 80s as an initiation group. And of course, if you change your initiation, you improve your duration as well. And at 2 weeks, 66% of our babies were getting breast milk after baby friendly, up from 28%. So that work inspired me to do more work with baby friendly. I saw there with my own eyes how much it worked, and we looked at our data and we knew it was working. And since that time, I still am at Boston University, but I've moved more into teaching and implementation. And I've worked on the project in New Jersey with Laurie Feldman Winter, where we worked with 10 different hospitals towards baby friendly. I'm currently working in Oklahoma with Becky Mantle on a statewide project that eventually aims to make the whole state baby friendly. I was a faculty region for the East on the NICU project, which had 89 hospitals going for baby friendly, which is we're coming to the end of that 3-year project, and probably towards half of those hospitals we're thinking are going to become designated. And then I also have been working with the Indian Health Service. They have 13 birthing hospitals across the country, 9 of which are already designated, and the other 4 are very close. They're all under assessment. So that's the kind of work that I've been doing, and that's why hopefully they had faith in me to head up the hospital end of this project. And now I'm turning it over to Kim, who's going to talk a little bit about the work she's been doing and what her role is.
Hello, everyone. It is really a pleasure to be associated with this initiative. And you all that know me know I absolutely love New Orleans. But I became very interested in breastfeeding 36 years ago when I had my first set of twins, and had absolutely no one at all to help me, so I failed miserably. So as a nurse, I started to learn, who didn't learn anything in my professional training, started to learn everything I could because I did serve women and children because I was a pediatric nurse. So I just focused on breastfeeding. And as I did so, became a WellStart associate and associated with Dr. Audrey Naylor, who is my mentor mom today, who has taught me so much and continues to learn.
How do I get it on speaker now?
Can you hear me? I'm sorry.
Guys, could you mute your lines, please? If you're not speaking, we can hear you. Thank you.
Okay, and so just with that, I say that God gave me a second set of twins 12 years later so I could fix all those breastfeeding problems that I had with the first set. But, you know, my focus was, again, to be able to help the mothers who sick babies that I was serving to be able to be successful at their goal of choosing breastfeeding. So for the last 35 years, I have worked in the breastfeeding arena and was very happy to be part of the Best Fed initiative and working with the hospitals in the Southeast, and now to be associated with this initiative, which we did really well with Best Start, and we're going to continue to do really well, and we're seeing such a difference in the health and just inequities and disparities as this initiative grows. So I'm just really happy to be part of this initiative. Thank you.
Thank you, Kim. And Jerry McKinley's going to speak. Jerry is working with us in a very specific area of New Orleans. We're going to be working with her on a conference. So, Jerry, would you like to introduce yourself? Is Jerry on the phone?
Everybody, yes.
Good, go ahead.
Hear me?
Yes, yes, just speak up a little bit.
All right.
Great.
Hello, everyone. I'm Jerry McKinley with Health Connect One. I'm delighted to be working on this breastfeeding initiative that ties communities and hospitals together. And one of the things that Health Connect One has already started to do, along with some of our other Kellogg grantee organizations, is to look at the impact of community health workers. And so as a starting off place for CHAMPS and Health Connect One working in this region, we're going to be hosting a peer-to-peer support summit. It's a regional meeting called The Power of Peer-to-Peer Support. It's coming up soon, October 21st in New Orleans, and we, as you see on the slide, gives you just a brief breakout of what we're going to be doing. And as part of the roundtable discussions in the afternoon, we're going to have a CHAMPS specific roundtable discussion. Our hosting sponsor is the W.K. Kellogg Foundation, as I mentioned before, and so because of that funding, we're able to provide these resources at a very minimal cost. It's only $45 to attend for the one day, and it includes continental breakfast. It includes lunch and a welcome that will allow you to meet, hopefully, Dr. Keir Perry that you've heard before, and also Kim Bugg doing a presentation on breastfeeding. It will be hosted by Dillard University, and they will be welcoming you as well. There'll be student nurses attending, community health workers attending. And so we look forward to seeing you in New Orleans on October 21st.
Thank you, Jerry. And I'm really excited that we're going to be able to partner with Jerry's organization so that I'll be there, Kim will be there, and we'll have a whole 1 hour session in the afternoon at the round table for anyone who's interested to work with us and to come to learn more about CHAMPS. And I think it's really great to be able to launch it in the community right there, so that hopefully those of you on the call from the hospitals and who are interested will actually be able to get someone to that conference, and right from the beginning we'll be able to integrate some of the community work with the hospitals. So thank you, Jerry, that's great. We do have a larger team working on this. Not all of them are going to speak on the phone today, but we do have a group of experts who are part of this project who have been doing a lot of work in other places. Roger Edwards is in Massachusetts here with me. He's at Northeastern University, and he's done a lot of work in the community with a CDC community grant out in Massachusetts. Emily Taylor has worked in New York and extensively across the country with hospitals becoming baby-friendly. Laurie Feldman-Winter is a physician who was on the Breastfed Beginnings project, and he's one of the people that works a lot with physicians on this project, and is also very high up in the AAP and able to connect and bring in and teach physicians. So if you have resistant doctors at your hospital, we send Laurie to you. My own division is the Division of Pediatrics at BU, Boston Medical Center, and I have a couple of people, physicians that we're working with here, especially to look at some of the assessment of community breastfeeding rates pre and post our intervention. Mike Silverstein, who is my boss, and Renee Boynton-Jarrett. And because we're holding this webinar in the morning, some of these doctors can't be on the call because they're in clinic, but they are very much part of the project, and you will be seeing them and hearing from them as we go along. Our project management team is Laura Burnham, who is the project manager for this initiative, and Apexa, who is the coordinator. And they're doing a lot of the behind-the-scenes work, organizing the webinars, putting up our brand-new website. And then Doug Rockwell is our accountant. So we have a structured environment in place to support this project from the administrative perspective as well. So let's get to what we want to do here. What are we hoping to do? And my area of expertise is working with hospitals. So Overall, we're going to be working with the hospitals that are interested to sign up, and we'll tell you a little bit more about that as we get to the hospital towards the end of the discussion, how you can register your interest. But we're going to be working with hospitals to increase compliance with the 10 steps. 10 steps to successful breastfeeding, which is the core of the Baby-Friendly Hospital Initiative. We have learned a lot of things from being on the NICHQ Breastfed Beginnings project. One of the things we have learned is that we have to help hospitals a little bit more to collect data, and personally I have thought that we don't need to get as much data as we did for that project to make it too burdensome, but we do want to get some data from the hospitals, and we want to help the hospitals be able to look at their own data and feed it back to themselves and work out where they're at. So the three things that I would really like to work with the hospitals to measure would be the breastfeeding rates, and any hospital that's over 1,000 births right now has to have Joint Commission data on breastfeeding. So my experience has been that many hospitals don't know how to collect that data properly. So we will help you. We already have the Joint Commission agreeing with us that they will help us to work on this. And we will help the hospitals involved to collect breastfeeding data exclusivity and any breastfeeding, so per the Joint Commission standards. So that's one thing we will help you with. We also want to work together with you on improving and charting skin-to-skin care and improving and charting rooming in. So we will work with you on that, because those are two of the areas that we have found in our experience are really poorly measured in the hospitals, and yet they're two of the most important practice areas to work on improving. So we're going to do this by connecting with interested hospitals, hopefully some of whom are on the phone today, and will reach out to us. We had a great response already from Mississippi, so we're looking forward to hearing more from Louisiana and New Orleans. But part of this project is really dedicated not just to the hospitals, but to connecting with the community around the hospitals and to work with the communities and the hospitals together. So I'm going to turn the next 3 slides over to Kim, who's going to talk a little bit about some of the more altruistic reasons that we should be doing in this, and then talk about what her goals are for working with communities. Kim?
Okay. So we all know that place matters. Just this past week, an article came out, the worst and best places for women to have babies. And when you get the opportunity, please Google it. Of course, there are going to be a lot of things on there that we don't agree with, you know, some of the ways that they collected some information. But what we need to know and what we always see is the fact that Georgia, where I am, and Louisiana, Mississippi, Alabama, we are always on the bottom. And so this report goes through why those 4 states, along with a couple other, are the worst places for women to have babies. And that's just not someplace that we want to be. We know that the inequities and health issues are disproportionately worse in the places where we are. And we are striving. We see those of us that have been in the places where we are for a while know that things have dramatically gotten better. But the gap doesn't seem to be closing. Those who are, you know, even though the rates are going up, the initiation rates in breastfeeding are going up, the gap between the white moms and black moms still remain about the same. So it's imperative that we bring along everyone as we're working on these initiatives. And we don't want to be at the bottom of the list of the worst places for women to have babies. Recently, we have learned a lot in Rose about collective impact. And this initiative does such a phenomenal job. Just looking at the people who are on this call, it is phenomenal. And just working together, we know that, and you've already made a significant difference with all the things that you've done. And hopefully this will just be a little extra that can sort of get us over the hump to truly getting baby-friendly hospitals, because we know that a rising tide floats all boats. And Louisiana got 2 baby-friendly hospitals in August of 2014, which is phenomenal. Georgia still doesn't have any. So we're still working on that really hard. But with those two hospitals, and again, none being in New Orleans and NOLA, we need to make sure that we, of course, are able to get that. So working together on policy, on programs, on peers, and on partners is what the Surgeon General's report has evidence says makes a difference, and that's where we can change all of these statistics that we want to increase. And so we're working with baby filling hospitals and getting them along, even if, as Ann says, not all of the hospitals actually get into designation. We know for a fact that if hospitals have an infant feeding policy, then that's going to make a difference, because as healthcare providers in the hospitals, we don't do anything unless we have a policy. So we are so happy to be a part of this and to make these differences in all the places, and especially where we are, where we live. So these are a couple of things that we're looking at in the community, along with your assistance, along with your help. So please, if at all possible, come and be a part of the community forum that Health Connect One is sponsoring, so that we can talk about your needs. But we want to involve community partners immediately, if not at all possible. I'm doing a WIC training today, and I've been told so much in this city as I go to the hospitals here in Atlanta that WIC is a partner. We talk to WIC, or we send our moms to WIC, and I'm here with a huge WIC gathering, and nobody here knows anything about that. So it's imperative that you have the people in the community be part of the teams, and not later, not as an afterthought, but as soon as you start to develop teams, because it truly does make a difference, and they have tremendous things to offer. Link with the perinatal community around the hospitals is very important. We're going to create what we call breastfeeding clubs, because young women don't like support groups. And I hear so much as I travel to do the mock surveys, why don't they come to our support groups? We put up a flyer, and these women, and, that has a lot to do with it there. But you just got to understand where people are coming from. And young folks, and I talk with young folks all the time, they don't like support groups. So we have to find other names, and then we're going to reach out to non-traditional partners, to communities, so that our mothers who go back to work really early can still possibly be able to fit breastfeeding into their lifestyle. And the next one, please. So this is just a group of women in different settings. Some of these moms, the ones up in the top left-hand corner, they were not hired by WIC, but they were all WIC participants who had breastfed for a long time and just came to get some training so that they could work in their community with their friends, with their family, teaching aunties and grandmamas about breastfeeding. The ladies on the other side are a group of Hispanic moms who, again, did the same thing. They were not actually hired to do anything, to actually work in the breastfeeding arena, but they wanted the information to have it in their communities. The ladies at the bottom are some attorneys and accountants, and one is a pediatrician, and they wanted to do the same thing. So it's not just about one or two groups. They're peers. They're different levels of people, and the important thing is just to make sure that we bring the community in so that, and give them some evidence so that they can help moms be successful at initiating and continuing to breastfeed. And
thank you, Kim.
I think that's it.
Yes, thank you very much. So what can we offer you if we come in? And as I say in a later slide, there's no fee for this. Someone asked us on the last webinar, well, how much are you going to charge? This is supported by Kellogg, so there's no fee to us for this project for the hospitals that are selected. The help that we can offer based on the great experience that all the different participants that are on our team bring to the table is a lot of pragmatic knowledge about what to change and how to change it. We will do regular webinars and phone conferences, and I know we've already spoken with Monica and the Department of Health there. The target area is New Orleans. That is where Kellogg focuses funding. But we will make this information accessible to a large group of people throughout the state. So if we're doing a webinar, it won't be restricted to the hospitals that are actually only signed up for the project. We will make as much of this information as broadly accessible as possible. We can offer training. We have Kim, who can do community training and healthcare training. We also have some money in our budget for your nursing staff to be able to do online training. We wouldn't be able to pay for the nurses' time to do that training, but we certainly can pay for training slots in the online program, which is part of what's required for Baby Friendly, that nurses complete a 15-hour course, and we can help to pay for that. We also have a 3-hour physician course already that's available through our website, which is free, 3-hour CME course, thanks to Northeastern and Rogers' work there in Massachusetts, so that's also something we can offer you. We have QI specialists. We have Emily Taylor on the phone. We also have worked with the NIDGQ project, so many of us have become grounded in the basics of QI, and we can help you with PDSAs and tests of change to help you start to change some of those practices that, you know, you just need to start with one mom and do some changes and get the practice off the ground. So we can help you with QI training and guidance. And then we have physicians on our team who can give you, help your physicians get over some of the barriers that they may have and answer their questions from the medical's perspective. We have written many policies between us, so we can get you up and running with your policy and charting and records and medical records and where to put this stuff and how to keep track of what you're doing. We offer site visits. We'll be able to come to most of the hospitals in the project. We'll probably at some point we'll be able to come to all the hospitals in the project. We also offer something that many of the hospitals that we've been talking to have really expressed interest in, which is helping you with clinics off-site. So one of the biggest challenges for the baby-friendly hospital would-bes that we've helped and worked with is that they do not have direct control over the prenatal education of many of their patients. So maybe they have one prenatal clinic which serves maybe 20% of the people who are seen in their hospital, but the other 80% of moms are being seen in different offices and just sent to the hospital. And much as they've tried to work and outreach with some of these clinics, it's been very difficult for them to do that. So you have a lot of moms coming in who don't know that the hospital is now doing rooming in, and then are upset because they can't send the baby to the nursery. So we will work with those clinics to help provide education for them. And hopefully that's a big benefit to the hospitals. You'll also have access to the Kellogg Field Builders, which includes the U.S. Breastfeeding Committee, Baby Friendly USA, and Health Connect One, who, as you heard, is on the phone with us today. We have some expectations of those hospitals that sign up. We want you to have a committed team with clear leadership and buy-in. We don't want the lactation consultant at the hospital sneaking this in without really anyone in the rest of the hospital knowing, and then we get there and there's such resistance that nothing's ever going to change. We anticipate resistance, but we do need some dedication from the hospital, from people in positions of some level of leadership and impact to be able to say, okay, we are prepared to make some changes and we will work with you to do that. We need a hospital that will self-assess themselves honestly. Sometimes I wonder how long I should be doing this for. I kind of run out of patience with these hospitals that have been stuck in one phase for 5 years. And for example, one that I spoke to recently said they just can't get baby friendly because they can't put the 10 steps up on the wall because they're not allowed to post things that size. And, we need you to be willing to do things. We also need you to be able to honestly say if you think that it's going to take such and such amount of time to do this, because other places will say, oh, yes, we're going to be baby-friendly next year, but we haven't figured out if we're actually ever going to be able to pay for our formula. Well, you need to be able to pay for your formula. So we need you to be able to assess yourselves honestly and have realistic expectations for where you can go. We also expect you to be able to send people to regional meetings and to also host us when we come there. And the meeting that Jerry mentioned, which we will just put up on the screen again in a minute, is the first time that we will have to interact directly with any of you there, because I'm going to be at that meeting and so is Kim, and that's on October 21st, so it's not that far away. So if you will register and go to that meeting, we will be there. And as Jerry said, it's only $45. It's a contribution to the community effort, and you will meet not just us, but many members of your communities who are doing things. So that's really important too. We will expect you to participate in webinars like this one and phone calls with us, and also to do stuff. We've had lots of hospitals that have sit through all our beautiful webinars and don't actually seem to listen, because 3 years on in the NICHQ project, they're asking questions that we have supplied the answers to consistently over 2.5 years, and they still are not getting it or doing things. So we do expect some activity on your end for all the work that we put into. We promise you we are aware of your time constraints as hospitals. We will not take lots and lots of your time to be doing things like data entry. We will try to work our calls in with your schedules. We'll offer you strategies that we've already tried and tested that we know work. We will tell you if we think that you're not headed in the right direction and there are things that you need to do to fix this, and we will tell you what stuff you can do, and we will listen to you, and we will help you. As I said, there's no cost to sign up for the initiative. There are some costs associated with becoming baby-friendly. Those costs are mostly directed to the actual process of baby-friendly, and you can all go and check out the website, the Baby Friendly USA website. They spell out the process that they need you to go through for designation. And there are some costs involved in that as you go along, including the cost of paying their assessors to come out to your hospital. In the terms of the budget of most bigger hospitals, those costs are not excessive. You will need to pay some money because you will have to train your nursing staff, and nursing staff need to be funded usually for the training time. So that is a cost that the hospital takes. But obviously, they're doing CEU trainings, that kind of thing, then you can get that. You know, it has payback for the staff, but you would need to pay that time. And then, as I said, we have some money to pay for training courses, and we have a free 3-hour course that your physicians can do. So what do you do if you're interested? Well, the next steps would be to email. Laura Burnham at bmc.org is our main contact person for this. If you email Laura, or if you email any of us on the project, we can get that information to Laura if you're interested to sign up either as a community group, to be involved, to be able to pressure your hospital and work in your area, or as an organization. For example, we had the Black Nurses Organization of Mississippi expressed great interest in this when we did our previous webinar. You can visit our brand new website. I'm going to put the link up there. And we are coming to you. So October 21st, Kim and myself will be at the conference that is working with Jerry and Health Connect One and the Birthing Project, and Dr. Krier should also be there. So we'll be at that conference, and we can sit down with you and talk about this and talk through it. And I will also be there with Laura for the APHA conference, which is happening in New Orleans in the 17th of November, and I'm planning to be there all week. So there's another opportunity to talk with us when we're there, or to maybe have us do 1 or 2 hospital site visits. So again, this is the conference that Jerry discussed, that where we're going to be. We will put the website link onto our website so that you can go through there and sign up for that conference. And these are our contact information. CHAMPS Breastfeed is an overall email address that you can use to reach any of us. And then the website is the champsbreastfeed.org website, and these are the people that you can contact. So I'll leave this screen up for a few minutes, and we do have about 10 minutes left, so please feel free to open up your mics, ask questions. Any of our team members who are on the phone, feel free to speak up or answer the questions. So please go ahead and ask if you have any questions, and thank you very much for listening in and being part of the project. I don't know if that's someone trying to ask a question. It's very, very faint. Any questions? I can hear someone talking, but I can't hear. If you're asking a question, I can't hear. Do we have any hospitals on the phone? I saw that Cindy was on there. I know Cindy had a big group of hospitals from the Oshna system that were together.
What do I do? Yeah. It's on mute. Okay, so unmuted. How do I?
You guys have any questions there?
Yeah. Can you hear us?
Yes, who's that?
You're unmuted. Dr. Mearwood?
Yes?
Hi, this is Cindy in New Orleans, and I've got a bunch of hospitals here viewing your webinar. Thank you so much for having us. We were wondering if this webinar was recorded.
Yes, it's been recorded, yes.
Oh, awesome. So we would be able to view it again at the CHAMPS website?
Yes. Yep, we should have it up there within the next day or two. It'll be up on the website, yep.
Thank you very much.
And just tell us who are the hospitals that you have there, Cindy?
I have Ochsner Baptist, Ochsner Baton Rouge Center, Ochsner North Shore, Ochsner West Bank. I have Touro Infirmary. I have St. Tammany Hospital. I have East Jefferson General Hospital, North Oaks, Terrebonne General, Thibodeau General, and Tulane Lakeside.
Cindy, why don't you give us a little bit of background information as to how come you managed to have all those hospitals in the same room? I know you had told me a bit about it. Why don't you just explain to the others on the phone what your group is?
Well, we are a mini summit. Back in June, Dr. Bobby Phillips came down to New Orleans with some other faculty and presented a mother-baby summit here in New Orleans, which just motivated us to move toward baby-friendly designation. We already had 4 hospitals in the area that are in the Best Fed Beginnings program, and our Ochsner Baton Rouge Hospital at the time was waiting to hear back from Baby-Friendly about designation. And so there's just a lot of interest in Baby-Friendly designation. So I decided to have mini summits and invite those 5 hospitals that were in the pathway, the 4D pathway for designation, to act as experts. And so they are sharing their experiences with other hospitals throughout southeast Louisiana. And so we're taking 1 or 2 or 3 steps at a time at our mini summit, and they're sharing their experiences with us so that we can use their experiences to move forward also. It's awesome. It's wonderful.
Great, and congratulations to Ochsner Baton Rouge for being the first baby-friendly hospital in the state.
Yay! Right? And also Terrebonne General.
Right, Terrebonne.
Yes, and Terrebonne now, yes, Terrebonne's baby-friendly as well, so. I hate to put competition, although I don't really hate to put competition. I think competition's fun, but you know, you're ahead of Mississippi, so let's see what's going to happen next, because maybe they'll come in there.
Very hospitals.
Great. Thank you very much, Cindy, and we will definitely be working with your group, and we hope to get some connections going there. Anybody else, anything to speak of? We have some of our other experts on the phone from the project, if anyone wants to add any ideas or share anything.
Okay, this is Joan. I'm in the group with Cindy, so I don't know what we're going to call our group here, the new Louisiana cohort. Anyway, do you suggest we register as this group, or we should register as each individual campuses?
I think that it would be, so we have planned to do individual hospitals, but we are not people who have fixed ideas. We're open to changing and adapting to suit the situation. I would like, because we have our funders who are maybe on the phone as well, and we have our own kind of ideas about creating specific hospitals and making them baby-friendly and working with them. However, that said, you know, if you're working in a group already, there's no way we're going to say, well, you know, 3 hospitals and the rest of you go away or anything like that. We're not going to work like that. For our own records and our information, yes, we would like to see the names of the individual hospitals who are interested in becoming baby-friendly. But you could also send an email in, Cindy, just, you know, listing the group members and giving us I know we've spoken, but it would be nice if we have it in writing. Find a name for yourselves, and we'll find a way to work with your group, and maybe, you know, you'll be the forum for other hospitals that want to come in and join together and meet regularly, and we can do some of our webinars targeted at the days that your groups are together so that we can reach as broad a group as possible. But the short answer is yes, please send in individual names of hospitals interested, but you might want to identify that you're part of the Ochsner, whatever you decide to call yourselves, just put on there that, you know, you're part of that group with Cindy.
Dr. Mearwood, we also have, Louisiana also has some good news. Ochsner Baptist has registered with Baby Friendly, and one of our other campuses, Ochsner West Bank, has just gotten permission from their executive team to register and go forward also. So
that's fantastic.
There is a fire lit in Southeast Louisiana.
Well done. And I'm going to ask you a favor. Can you reach out? I already reached out, but you have one Ochsner hospital in Mississippi, and I did call them up like a cold call. I felt like a salesman. It was kind of nerve-wracking. I just rang them up and said, hey, you know, Ochsner, we hear you're all over Baby Friendly in Louisiana. What about you guys in your one hospital? And they were kind of like, who is this? Maybe you can reach out. They do have people there that do breastfeeding, so, you know, bring them into the fold and see if we can get them going in the Mississippi area, because right now they haven't shown us, they haven't outreached to us, but I know they're there, and hopefully if Ochsner is into getting Baby Friendly, then your lone representative out in Mississippi might be able to be pulled in as well. Great, thank you. Other questions or comments?
Yes, this is Charlotte Parent. I'm the Director of Health for the City of New Orleans, and while we don't have any relationship in the sense to the baby-friendly piece in the hospitals, we are a Kellogg grantee in terms of our Strong Start Breastfeeding Initiative within our WIC clinic. So very supportive of what we're trying to achieve here. Loved hearing all that applause from all those hospitals who are looking towards moving towards this, and the city will do whatever we can to assist and support the activities.
Thank you. That's great to have your help.
That's excellent, because and we know that, you know, that they're going to be in that hospital for 48 hours. And so after they get out of the hospital, it's imperative that we have the community ready for them. And so that's going to take a lot of effort and energy. And so I'm really looking forward to working with you two, Ms. Parent.
Yeah, I think what I will say, Kellogg has put several grant initiatives here in the city working on on that topic of breastfeeding, and a lot of us are focused on the community side, on changing the paradigm on how people think of breastfeeding, and that we look at it not only as the nutritional support to get to a healthy start, but also as a bonding issue, and just shifting the paradigm that people think of this as the social norm. Like I said, there's at least 3 groups here who have been supported to make that move, and all of those groups, I'm sure, would be happy, more than happy, to work with these hospitals to move forward.
Lovely.
Thank you.
Beautiful.
Hi.
Thank you.
Hi, Ann. This is Marcy Brewer. I'm the Breastfeeding Program Manager for the Bureau of Family Health, and I just wanted to say, you know, welcome to you and all of the CHAMPS staff, and we're really excited about this initiative, and I think it's really great timing. Our Director of the Bureau of Family Health has allocated some additional resources this year to help expand our hospital-based breastfeeding initiative and give hospitals more support through technical assistance and training, as well as working with COEFFECTIVE to really implement a comprehensive community-based approach to steps 3 and 10. And so I really look forward to talking with you and your team and seeing how we can leverage resources and really partner going forward to have a big impact. So welcome and thanks.
Thank you. Thank you. Anyone else? Well, we're almost at 11, so thank you again very much, all of you. As we said, the webinar's being recorded, so you can access it through our website. We will be there before very long. We'll be there at the Health Connect 1 conference on October 21st, and then back again in November at the APHA meeting, although I am involved in the APHA meeting, so I'm going to be available some of the time, not the whole week, but some of the time. So thank you very much for joining. We will definitely be in touch. We are excited, especially about the community support that's being shown, and also about that big group of hospitals that you've already got going. So hopefully our efforts will all come together, and it'll be a shining star for the South in that area. So thank you very much. If you have anything else that you think of after the conference, please feel free to email us, and we really look forward to working with you all going forward. Thank you.
Thank you, CHAMPS team.
Thank you. Bye-bye.